Welcome to UO Today. I'm Paul Peppis, Director of the Oregon Humanities Center. My guest today is Autumn Shafer, Assistant Professor of Public Relations in the School of Journalism and Communication. Her research seeks to address social, theoretical, and practical issues related to public health promotion and social issues advocacy. Shafer's principal focus is sexual health, although she has also studied messages about tobacco, the HPV vaccination, nutrition, diabetes, and eating disorders. She recently secured a National Institute for Transportation and Communities grant for her project, Engaging Youth to Increase Their Transportation System Support, Understanding, and Use. Shafer joined the UO faculty in 2015. Thank you, Autumn, for coming on the show.
Thanks for having me, Paul.
So tell us a bit about your background and how that led you to this career in PR, communications, and journalism in the academy.
Well, first of all, I've always loved school. I've probably loved school before I even was in school. I'm a big fan of education and learning new things. I come from a somewhat impoverished background. I'm a first-generation college student. My parents were very much supportive of education and believed in it and encouraged me in that way. There was a short time even that we were homeless when I was about 8 years old. And I just always felt school was like this place where, you know, I felt like, oh, I love this place. I feel so great here. It's just happy and, you know, all these things to do. And so I've always been a bit of a nerd. And I actually was a big math person. I love math. I was a mathlete in high school, and I knew I was going to go to college. And I was originally planning on being a chemistry major with a math minor. But I took a required communication class, like many people do their freshman year, and I thought, ooh, I kind of like this. I'm going to take another one. And then all of a sudden, I was a communication major, you know, just kind of snowballed. And I fell in love with this idea of like learning about how we talk, how we interpret things differently. How can the way that I say something change the meaning that has for you? And I just loved it. And I went for my undergrad, and I went straight to get my master's in it as well, and just continued to just love it. So yeah, that's kind of what brought me to
so
that major.
what led you to health communication in particular?
Yeah, so when I was getting my master's, you know, learning more about research and, you know, what you can find out through some of these things and how you can have an impact, I was, you know, like we all do, thinking about my personal background, and I had some friends and family that were involved in substance abuse, and that was something that I felt like, gosh, I wish there was something I could do about that, and how could communication be a part of that? And I originally was really interested in different types of health campaigns. My master's thesis was focusing on tobacco reduction, specifically with teens, and so that's how it started for me. It's just really having a passion about wanting to make a difference.
So one of the things that you hear when you talk to people about communication is strategic communication. Yeah. So what is that?
Okay. Well, you know, something I explain to my students is there are different types of communication purposes, especially. Sometimes we just want to pass along information, and that's great, and that can be really important and necessary part of any type of health campaign or something. But sometimes we need to do more than just give information. We want to promote a certain outcome. So we want to encourage people to get a mammogram, for instance, to see if they, to possibly detect cancer earlier. So for some, you know, good purpose. And so, and sometimes, you know, we found that just telling people about, hey, you should get a mammogram, or giving them information about where to get it isn't enough. They need more strategic communication that targets them specifically, like, hey, you know, you have this, you know, communicating specifically with people that have a fear about the results, for instance, and then being strategic about what you tell those people, and how you make sure that you explain, like, here's what would happen if you got this result, here's the number of people that get this result, and sort of just meeting people with the information that they need, but understanding that sometimes through strategic communication, we have a purpose behind the communication of getting people to think or do a certain thing.
Interesting. So tell us about, to elaborate, tell us about one of these health communication research projects that you've either completed or are working on now, or are thinking of working on. Tell us about one of those.
Great, yeah. So a big project that I am just in the middle of and is launching out to the public this summer is a collaboration with OHSU and their Night Cancer Center. So they have been planning something for years now, and so I'm joining the team a little bit late, but still happy to join. They have an initiative called the Healthy Oregon Project, where they will be trying to reach all Oregonians, and starting with the northern Oregon coast, to get them to participate by donating a sample of their spit. And for genetic testing, people will get for genetic cancer risk testing, people will get those results back. And also they have genetic counselors on hand and patient navigators to sort of help people, for the very few people who do get a positive result. But in addition to the genetic testing component, they also have a series of surveys where you can see about how does your nutrition, your sort of dietary habits line up with cancer risk? How does your sleep line up with cancer risk? And they have several other things. So they're trying to help Oregonians understand their genetic risk for cancer, and then also their lifestyle risk for cancer. And so my part is to basically help explain to people, why would you want to be in this program? What are the benefits of signing up? What are the risks of signing up? And sort of doing some health communication to get people interested in participating, or interested in at least learning more.
So say a little bit more about that. I mean, I could imagine I'm a person who has an anxiety. I'm a 56-year-old person. I could possibly be at risk for cancer. I don't really want to know that.
Yeah.
So how are you going to help me to overcome my resistance?
Yeah, that is such a great question, because this we often find that in detection when we're trying to get people to do a behavior that's going to detect something they don't want to know about, or don't want. So that's one of the toughest sort of behaviors to get people to do. But you can help alleviate that by helping them envision what is the outcome going to be in terms of if I get this bad news, what will happen? And that's in terms of building in social supports. So having these genetic letting them know, we won't just give you your results and let you stew on it. People will be there to explain, what do these mean? How can you access health care? What do you need to do? So letting people know that if they get bad news, that people will be there for them. So letting them know there's some social and system supports can often alleviate some of those fears.
So why do you need research to do this kind of work? Why is research important? Why do we need to do that?
Yeah, so part of what I'm doing, for instance, with this project, and what I do with a lot of health communication projects, is I first start out with research about who the target public is, and often that will be through focus groups or interviews or some other qualitative method where I'm getting to know the people that I'm going to be creating messages targeting. So what do they care about? What do they need to hear? What are their values? Why would this be a benefit to them? What are the barriers they're experiencing? So, if you're working on a exercise campaign, for instance, you need to know, are the people in the community I'm going to be working with, do they have sidewalks? Do they have time? So, so getting to know your specific target public through research is just so important, and changes completely the direction of the messages that you would have. And then the second part of that I really enjoy doing is more experimental research, where we then create some theory-based messages sort of with clues from that formative research that we learned about people from focus groups or interviews. And we in fact test some theories, so this theory says if you emphasize how to overcome barriers, and this theory says, no, you should focus on all the benefits. And so we can kind of also contribute to the larger scholarly knowledge by testing the effects of these messages and finding out, wow, this really works well in these populations, but this message seems to work better with these populations. So it's really great. And then obviously you can evaluate the whole program at the end.
So I know that one thing that's important to you is including undergraduate students in your research project. So why is that important for you?
Well, I felt like I had professors who included me even as an undergraduate, and it just, really sparked more of my passion for learning and also understanding what is it that we professors do. I bring up research every day in my classes and let students know, these are the things I'm working on. And I have one undergraduate right now who's doing a research credit with me, and she's working to support a condom use campaign that the health marketing folks at University of Oregon are designing. And so, she may not go further with academia, but she'll get a better understanding when she moves on to her career about, how you communicate with people and what's important to know so that you can build good messages. And I mean, the undergraduates are wonderful. One of my favorite publications was with an undergraduate that I had recently, and she had a passion about sex trafficking, eliminating sex trafficking, and she wanted her whole career to be about that. And so I said, okay, let's do something. Let's think of something. And we ended up doing this great study looking at how sex trafficking victims and survivors, their stories are told in the media, and whether there's a story versus more of a non-story version, like a non-narrative version, and how that impacts the way people receive those stories, and whether they want to share those communications and support victim services. And in fact, it did make a difference. So, and it was great. So I felt like I was contributing to her career passion. She gave me a great idea. She was so passionate about working on it. And also, we were able to send some of these results to some of the big human trafficking NGOs and let them know, because they do this type of messaging all the time. So it just felt like everyone was benefiting from it. And it's just nice to be involved with something like that.
Cool. So a related thing that you do is work on sexual consent education. Tell us about that research and what you learned.
Yeah, so that's a topic I come back to quite a bit. And so one of the big projects from that I did recently was a campaign called Define Your Line. And so with that, again, it started out like I told you before. We actually had 11 focus groups with undergraduates, and this was right about the time that the White House had issued a statement directing campuses to do more on this issue. And so we were originally thinking we would do some type of bystander intervention where we were helping students understand how to be better bystanders or active bystanders. And after these focus groups, though, we realized, students actually don't really understand what a consensual situation is. There's a lot of variance on what they thought was or wasn't consent, and a lot of confusion. And so we thought, well, we're going to have a hard time helping them to, intervene in situations if they don't really know when a non-consensual situation is occurring. So we actually took a step back and said, first, we need to do some sexual consent education and help students understand what is and isn't sexual consent. And so we formed a group of 25 students on an advisory committee. We had the support of the university, so we were able to sort of get athletes and LGBTQ folks and fraternity and sorority folks, sort of kind of a community that trying to represent some of the major groups on campus. Religious groups were involved as well. And we sort of worked with them to create a campaign and decide, like, what are the tactics that are going to reach students? What are the things that you think they need to hear? And also drawing on, and I had a research partner who's at Syracuse now, drawing on, academic literature about the types of things that are likely to be effective. And we launched this campaign for a year. Students did tablings, they talked to classes, we had a website, all kinds, just multifaceted. And our evaluation of it showed that, in fact, we were able to change the campus climate in terms of having a better understanding about consent, being more willing to verbalize consent, ask for consent. So it had some really positive effects. And we've since published it in a couple of different places, and 3 other campuses have adopted a version of it as well. So it's exciting to see it kind of continue. And I hope to keep working on that issue. It's something that I'm definitely passionate about.
Oh, that's cool. So this work that you do has you interface often with UO's Office of Health Promotion.
Yeah.
So say a little bit about the work you do with them and how you help them and how you collaborate with them.
Oh gosh, and they help me so much too. There's wonderful people here on campus working to help keep our students healthy. They're just amazing, the work that they do. And a lot of our relationship has actually been them as clients for my classes. So if I teach a class where we're learning how to plan a strategic campaign, I will often have I'll go to health marketing and I'll say, hey, what do you guys have coming up this year that you're, think that you're going to be working on? And they'll, like last year, they said dual use. Dual use was a big topic. And so my students did research to try to investigate what is the dual use on campus, and then also create some recommendations that we could pass on to the health promotion folks about, well, how could you address this issue with students? And so we've done so many issues with them: better sleep, better mental health, dual use, condom use. I'd probably like 10 more. So many, and then we're also doing research together. So they started a campaign called Protection Connection, where, I don't know if you've noticed them, but the EMU has 2 sexual health supply dispensers. The Rec Center has one, and there's also a sexual health supply delivery service that just started just this last January, so it's very new, with the dorms, where students can kind of anonymously, well, not confidentially, order sexual health supplies that'll get sent to them. And so in hopes that providing greater access to these will lead to more use of these. It's actually built on a campaign that a friend of mine did for her dissertation at UNC. And so I'm helping with that research as well in terms of evaluating it and advising it. And it's just a great partnership. And it's really fulfilling to feel like, oh, I'm doing research, but also it's being applied like in real time.
So you've talked pretty extensively about the variety of health communications research you do, but you've also done research related to public transit.
Yes.
So how did you get to that?
Yeah, so actually that started through another connection. Someone originally said, hey, we want to do a campaign, can you just consult for us? Just do a little bit of work. But that's just hard to actually fit my work ethic. It's hard for me to just do a little bit of work. So I just ended up kind of wedging in there, and then all of a sudden I was applying for my own grant. But it actually has public health ramifications as well. So I find it to be really interesting because I'm interested in environmental communication, but that's not my main area. Public health and public health promotion communication is. But this is where there's sort of some intersection. I'm also working with someone who's an expert in environmental communication. But traffic fatalities are the main cause of death in the US for people 10 to 24 years old. And there's been some really great research analyzing cities that have better transit access and more teens using that transit actually have lower fatality rates, traffic fatality rates. And 75% of the accidents that teens get into involve another car. So if we can get more teens to ride transit, it has a direct, really crucial benefit of hopefully reducing traffic fatalities among that population, but even outside of that population, the other cars that they're getting in these accidents with. So that was kind of the motivation behind there. And then we worked with Portland to kind of study what would help motivate teens to ride transit. And exciting, but just this week, I actually met with representatives from the Eugene, Springfield, and Bethel school districts and Lane Transit District and some others about how we might do some of that research locally because local teens are going to be able to get, K through 12 is going to be able to get a free transit pass starting in the fall. And so we want to do some work for how we can best promote the use of that and hopefully make a real difference. So
in terms of the Portland part of the project, what are some of the strategies that you determined would effectively impact the ways young people relate to public transit?
Yeah, so really, really interesting. One thing we found out was what wouldn't work, which was important because originally working with some of the transportation partners up there, they thought perhaps a text campaign to teens, getting them to sort of opt into these text messages. We found out absolutely not. Teens are not going to do that. And what we also found out is you might want to target the parents more directly. But messages about autonomy and how this will give them better freedom of choice. So they don't have to sit around waiting for their parents to give them a ride or hear their parents or watch their parents roll their eyes while they're waiting, asking for a ride. They can just go and do and see. So the autonomy messages were definitely seem to be the most impactful for teens and promoting that aspect of, and we looked at transit use, but also walking and biking. Yeah.
So you said that the texts didn't do the job. So what is the medium that you use? What did you find is the most effective medium to communicate with the youth about this?
Yeah, so the research suggested that they are looking at the transit page. So you could have ads or messages right on it because they're checking the bus when they go. They have to check the bus schedules. Right. They're sitting at the bus stop, so posters at the bus stops would be effective. So those sort of where they're at and when they're thinking about this types of stuff would be good. And there seemed to be some indication that perhaps parents might be interested in some of this text information, but we need to follow up with some more research to confirm that.
Yeah, that could be complicated.
Yeah.
I mean, the relationship with the parents is complicated.
Yeah, yeah.
So you've already made very clear that teaching is really important to you and that your own experience as a student impacted you. So tell us about one of the classes that you teach.
Well, the class I teach the most often is research methods. It's for strategic research methods. It's required for public relations majors, but I often get ad majors or psych majors, business majors take it as well. And in that class, we do a real, it's very high workload class, I feel like, but we actually, the students work typically with the Office of Health Promotions on an issue, and we do surveys with students. Last time I taught it, we collected 500 surveys from 500 students about condom use and almost 1,000 surveys about Juul use. And they do focus groups, they do interviews, we do user testing where they actually look at a website or an app and they have people come in and sort of try to do things on that website and figure out like what are the things that are going wrong, like what's the message this is sending me. We do a content analysis where we're looking at Twitter feeds and sort of what are the messages being promoted in these Twitter feeds and the strategies in the messages that might lead to like more engagement, likes and retweets. So we do all of that in 10 weeks, and but it's great, it's so fun, and students, I think, when they first, it's a required course for PR majors, doing research isn't top of their exciting list, I would say. There's a bit of a, they think it's going to be boring, and I think I'd make it come alive for them. I feel like I hear that from students, and by the end, like I actually have a meeting later today with a student who was in my class, and now she wants to do a survey again for another project she's working on, and she wants to just kind of check in with me about best practices, and I love that so much. I love when I hear them like, oh, we're doing this other research after class. I just like, oh, just makes me so happy.
Can I ask you, what did you find about Juul use when you have these 1,000 responses? What did we learn?
Well, it is it's the majority of students in our survey, which wasn't a random sample, but it was a large sample, are Juuling, not necessarily every 10 minutes, but sometimes that has pretty high acceptability rates. People don't see much wrong with it. There's very little understanding about the nicotine that's actually in a Juul cigarette. There's like this assumption that it's actually in a way a good thing. It's either they used to smoke and now they Juul, or it's preventing them from becoming a smoker. And in the focus groups, so the surveys kind of said a lot of that, and in the focus groups in particular, it just seemed like it's going to be a very tough issue to reverse. And I know the FDA and others, and I know it even going down to middle school age, it's definitely an issue I'd like to continue working on. It's going to be just as hard as tobacco was to actually make some progress on. It's going to be a decades-long fight, I think.
Interesting.
Yeah.
So, what attracted you to the University of Oregon? Why did you decide to come here?
Well, I'm from the Northwest. I'm from Washington State, so I've obviously known about UO for a long time. And after grad school, I was at a university in Texas, and I had two friends from grad school that were here, and of course we all talk still, and they were just saying all these innovative things they were sort of allowed to do in their teaching, and the support for research and the autonomy that they had, and I loved where I was as well, but I just felt like, wow, Oregon seems like a place that anything could be possible in some ways, and I could really just do the research that excited me, that there'd be a lot of support, and I was excited too about sort of the freedom that they give you and the encouragement really to put experiential opportunities into your teaching. So like I said with my research class, we don't just learn survey best practices. Everything we learn, we do. And that's really encouraged, at least in my school, to get their hands dirty, sort of and I like that. That's my style for sure.
So you and your colleague Jesse Abdenour are recipients of a 2019 Faculty Research Award. Tell us about that project.
Yeah, I'm excited. We've been actually talking about this for over a year, so it was great that we sort of put it down on paper, and I can't wait to start really collecting the data. But Jesse's background is as a journalist, And so he's used to creating very objective communication, not sort of with the purpose to persuade anyone. And I come from a very sort of promotional, persuasive background. And he is a lifelong athlete and got very interested in a boxer, actually. So he's very interested in the concussion issue. And obviously I'm interested in all kinds of health issues. So I often will do things with narratives and storytelling, which is a journalistic practice as well. And so we thought, let's come together and sort of put our strengths together. We want to look at how journalists tell the stories of concussion and how that impacts people's sort of understanding of the science of concussion, trust, which is a big issue over in the J School right now, sort of trust of the information, and then sort of learning from it, and also their intentions to allow their child or themselves or significant other to participate in activities that might have a higher risk of concussion. So we're sort of, and then eventually, so we'd like to build some theory around that, about how narratives operate in that science space, but then also give some advice to journalists about, hey, if you're covering concussion this way, this is how it may affect your audiences. If you talk about it like this is the types of understanding that they could walk away with. So it's kind of got something for both of us, and it's a great partnership. Yeah.
So we've just got a couple of minutes left. This will probably be my last question. So do you have, like, obviously you do so many things, but is there a new project or a project that's approaching you that you're interested in that you want to say a little bit about?
Well, we in the School of Journalism also have a Portland campus, and we just opened a VR lab in that Portland. Oh, I know. You've got to go see it, Paul, and you've got to interview them up there. And anyways, I took a tour of it and just realized, oh my gosh, the possibilities here. And so I don't have a specific project in mind. I have about 20 projects in mind, but I am working with the VR expert and some gaming experts on deciding something we might be able to do with VR and health. And so that's something I definitely see myself picking up in the next year or so, is trying to figure out like what I can do in that space, because I think that's exciting. Do you have any
suspicions about it?
Oh, well, I think as someone who does a lot with narratives and how narratives can help be like a proxy for direct experience, I think virtual reality will operate in that same sort of psychological space where it will help be a proxy for direct experience. So they may not be able to experience a certain health issue or an outcome, but they can in virtual reality. And when you have direct experience with something, that is very powerful in terms of influencing your attitudes about it and the decisions that you make around that. So I think it's going to be potentially a really powerful tool for health educators and health promoters. And I have so many ideas, Paul, but I know I've got to narrow them down. So I'll let you know.
Okay. Well, Autumn, it's been a real pleasure talking to you today about all the work that you're engaged with and all the exciting research that you do with your undergrads. It's really been a pleasure.
Yeah, it's been so nice talking with you. Thanks for having me.
You're welcome. I've been speaking with Autumn Shafer, Assistant Professor of Public Relations in the UO School of Journalism and Communications. Thanks so much for watching.